Dr. Niranjan Karthik on the topic Seeing the Unseen World, Role of Vision Therapy in Improving Quality of Vision and Life. 4 minutes.
Thank you, sir. Good afternoon to one and all. So today we're going to see an interesting topic of seeing the unseen world, the role of vision therapy in improving the quality of vision and that of life. So basics first, binocular single vision is the ability to use both eyes together, a single fuse perception even in the presence of disparity of the image seen by individual eyes. What is vergence? Simultaneous movement of both eyes in opposite direction, and accommodation is a process by which the eye changes its optical power. Now we know the three grades of BSV: fusion, simultaneous perception and stereopsis. So what is lazy eye? Basically reduction in vision in one eye caused by abnormal visual development in the early part of life. And what is vision therapy? Fully customized and personalized method to improve and strengthen the visual skills and retrain the visual system to harness the hidden potential for better quality of vision. So this is our foundation for the study. So our aim was to study the outcome of this vision therapy in improvement of the quality of BSV. That includes stereopsis and also accommodation and vergence. And also the added benefit was improvement in the best corrected visual acuity in patients with subnormal vision. So all patients with defective binocular single vision, amblyopia and vergence insufficiency were included, and those with strabismus due to neurological causes were excluded. So this procedure or the study had two main components. One is the assessment followed by vision therapy. So the assessment, though it looks complex, it's quite simple. It entails detailed history taking and followed by proper refraction, first with autorefractometer and then with proper subjective refraction. And in many cases, as indicated, we had to go for cyclorefraction followed by post-mydriatic test, after which the refractive error was finalized and the spectacle correction was given. So what is vision assessment comprise of? So regular vision assessment is what we already spoke of, subjective and objective refraction, whereas orthoptic evaluation had these four components assessed in using different tests as shown in the red boxes. So for this scarcity of time, just we'll assess them under these four headings of sensory, motor, vergence, accommodation and stereopsis. And following this, the ideally indicated candidates were started on vision therapy for two major things. One is for strengthening the focusing ability and improving the maintenance of this focusing ability. They were done using different tests as shown here. The strengthening was done by pencil push-ups, CAT card, lifesaver card, etc. While maintaining of this was done by equipments using Brock string, vectogram, gyroscope, etc. So what were the results? A total of 33 patients were included in our study, and the age ranged from 5 years to 27 years of age. The mean age was 11.4 years. The worst corrected visual acuity was 636. It's important to note that 91.3% had an improvement in best corrected visual acuity, as we can see here, and it varied between the different eyes as shown here. And this was clinically significant as the p-value was quite less than 0.01. Secondly, the stereopsis, NPC, vergence and accommodation also improved, and they also had statistically significant correlation as done by T-pair tests. Okay, and moving on to discussion, 91.3% had shown improvement in BCVA, 34.77% showed improvement at least 2 lines, and other parameters like stereopsis, near point of convergence, vergence facility and accommodation facility, all of them showed statistically significant improvement. And last but not the least, binocularity, remember, is a gift to mankind, and there are only few conditions of medicine where it requires the cooperation of a team, including ophthalmologists, parents and the child, and this vision therapy has proved a great difference in our clinical practice in treating amblyopia and abnormal BSV. Thank you. Yes, ma'am.
So, for treatment, you have given spectacles.
Yes, ma'am.
And
the different components of vision therapy for
to improve their binocularity, is it?
Yes, ma'am. Yes, ma'am.
Okay. And then you have assessed. So what are the various categories of treatment did you give?
First is the corrective refractive correction that we have given using glasses after a cyclopresic refraction. Followed by that, there are two components. One is to strengthen the binocularity, for which we used CAT card and pencil push-ups. And for maintaining this focusing ability, we use Brock string and vector charts, etc. So we use the different parameters, different equipments for improving on different parameters.
So you have the data of how many patients required these, or you use them in all patients?
Ma'am, those because of the paucity of time, I couldn't explain them in detail, but each patient was tailor-made for their deficiencies. Let's say their NPC was affected, they had more to do with pencil push-ups and convergence exercises, whereas those with difficulty in fusion, etc., were using gyroscope, so it was tailor-made for each one of them.